You'd rather for me to keep it at 72 so you can see. They can be done either way. You just have to adjust technique.
In the hospital, what do they typically, they usually do 72?
It's gonna be the text preferences.
Ah.
And most likely you're gonna see text doing it at 72 because most likely you're gonna get them all. Then when you come at 40.
Can we do 40 then?
Yes, I can do 40 right now.
So tight.
Is there any way you can hit the light and see if this one, not all the way, perfect. Okay, so now I'm gonna go to 40, but I want you guys to come closer because this is the ones that you guys got a little confused yesterday. So step to the side, Mija. So you will start with your chest x-ray at 72, okay? And then move your inches to 40. Go ahead and step to the side so I can make sure I'm okay. Center, okay. I'm good, okay, go ahead and come back here. So the procedure, it's gonna be the same, AP, except that instead of centering to the MSP, I'm gonna center to mid-clavicle. So I'm gonna make sure I have enough light. See my margins right here? Now I'm using lengthwise IR. And on the other one, I should have used lengthwise because I believe she uses, her body can be fit on a lengthwise for her. But I did it crosswise so you can see that a lot of patients for bilaterals will be crosswise. Make sense? Now I'm moving to lengthwise because I'm only doing one side and I need to get as much as I can upper, from the upper. So here we go. So I am balling this right here, and where do I want to place this mark right here, or the middle of my IR? Mid-clavicle, so let's find her. So right about there, okay, good, goody. Perfect. And I'm gonna do this. Where do I center for my APs? T7, just like a chest, just like an AP bilateral. I'm gonna open up my collimation, 14 by 17, and I'm gonna open enough to include, I don't want to be open like that and include this arm, do I? No. How much on this side do I want? So this is the external, the jugular notch. So just passing it. You see that? Jugular notch here? That's as far as you want. So you start off here and then you adjust here. So see all my collimation back here? So I'm gonna collimate even more. And I'm gonna move her over. You see this? This is all I need. And then I gotta make sure here to give her a little tiny more. You see that? And then relax your shoulder now. There you go. And this will be my right side. That's it. Take a deep breath in. Technique adjust. Expose. Right? Get it? Mid-clavicle. Now watch the trick. Good morning.
Good morning.
Now watch, this is the trick. I'm a mid-clavicle and I need to do one of the obliques, right? Do you guys want me to do upper and lowers for the unilaterals? Because the only thing is going to change will be the centering. Yeah. Yeah? Yes? Sorry.
Well,
T7 to L1.
T7 to L1.
You're just bringing it down.
I'm just bringing it down. Because I want to show you the trick here. Watch this. So let's say we got it all. If you didn't, you do the come down to L1. Okay? Let's say we're getting it all for her. The trick here, I have this amount of collimation. When I do 4 shortened ribs, do I need a small collimation or large open collimation?
Small.
Smaller, right? So all I'm gonna do is I'm gonna start with the one away from me. Can I have the sponge again? And it has the same procedure. Place the sponge right there. Go ahead and rest against the mouth. Mid-clavicle. Nice and pretty here. And all I have to worry about is to make sure I have light back here. So I'm just gonna push her a little bit. There you go. There you go. You see that? Because you want to concentrate more on this side, not so much getting this side. And what are the instructions for this?
Inspiration.
Yes. The only thing you have to watch in here, and please remember, is that, look at here, I don't see my shadow. You see that? So a lot of times you might have to do a little kick out. There you go. Okay? That's it. Mid-clavicle. So you're using 2 mid-clavicles, one for the AP, one for one of the obliques. What's my other centering? MSP. So what I'm gonna do from this step, okay, I'm gonna take my sponge, all right. And before anything else, oops, sorry. It's okay. Before anything else, before I start like getting all crazy and everything, what I'm gonna do is bring her right to my MSP right there. Okay, bring this down a little bit. Start off on my MSP right here, and I'm gonna keep an eye on here, not on here. Watch what happens. I'm gonna roll you now the opposite direction, and here is the sponge. And which side am I looking at now?
Still three.
Which side I was doing? Is it the upside or this side? Which side am I working on?
The right.
The right ribs. So see how your light is deceiving now? And what's the first thing you wanna do? You're gonna want to do? You're gonna be like, oh no, I don't want this side. Okay, you gotta move that way. Oh, now I'm good, right? That's what you're gonna do, but don't do it. Don't do it, Mo, because when you do that, you're only getting from here, and if you were able to cut her in half here, you will be missing the posterior articulation, which is what you want to. Remember that? So, this is what you do. You keep your eye on right here on the MSP or near the MSP, right there. And then you open your collimation a little bit. Right, you see this? Now, the centering is at your MSP or near your MSP, but look at what it looks like. It almost looks like it's mid-clavicle like here. That's what throws people off. But this is where you have to look at, because that's the most true representation of your central right entrance, not this. This is just looks like that because the patient is rotated. Make sense? So I want you to pay attention to that. Another thing I want you to pay attention is that your margin right here, your border of the light, will be just barely skimming the neck, the soft tissue neck. And you're at the MSP, and you make sure you got over here. That's it. Got it? Okay, relax for a minute. Then you do uppers and you do lowers. Okay? What's the time right now? You can probably